So, could you please tell the audience your name?
Hi, I'm Morgan Miller.
And Morgan, could you just tell us in your own words what the condition was that brought you to our office?
I had severe tension headaches. That was my chief complaint.
So the tension headaches were the main reason you sought care. How long had they been bothering you?
For about 2 years, and they were getting progressively worse.
Right, right. So, had you tried other treatments, or had you been seen by any other doctors for that?
I hadn't been seen by other doctors, but I was trying to remedy it on my own. Heating pads, ibuprofen, just things I could do like that.
Right, right. So, when it was at its worst, what was it like? How was it affecting your life?
Well, I'm a typist, and looking up and down at the computer all day does naturally create some tension, but having this problem on top of it, it would actually make me very ill at work, and I wouldn't be able to complete my job. It actually would get that bad. So, it was costing time, it was
Right.
costing me money. It was not good.
It was affecting your day-to-day activities when it got at its worst. How about outside the workplace? I mean, what?
I didn't want to miss out on anything, but I always had ibuprofen in my purse, a whole bottle of it, because I would just try and doctor it that way, and it wasn't a solution. It might make it feel a little better, but it never went away.
Just didn't seem to ever leave.
Mm-hmm.
So what did you do to change it? Could you just tell us briefly? Or?
I was at work and complaining of a headache again, and my coworker is a patient at Dr. Zimmer's, and she just said, "That's it, we're going this week," and the rest has been pretty wonderful.
Well, that's great. So you did take her suggestion to come in and get evaluated, and when you first came in, you had some ideas that maybe this was a place for you to be, but you weren't sure. And
I wasn't sure because you don't really think of a headache being treated by chiropractic means, and I was mistaken.
yeah, well, you were a little doubtful. I would say maybe in the beginning that this could work for you. So you did start care. What were some of the things you learned when you came to us about your condition?
Well, for one thing, I learned that the results might take a little while to get the full results, but to get relief is almost automatically. It's a wonderful thing.
Right.
And I learned some stretches I could do at home to help the progress along, and just like small things that I never even knew, like falling asleep on the couch isn't such a good thing to do.
Right. So there's been a process of learning things that you can do outside the office to help yourself, and that's great. How's your life today? How would you say things are right now?
Pretty carefree. I don't really worry about the headaches, and I don't think about them a whole lot, and today I don't even know if I have ibuprofen in my purse.
That's great. So you're really not focused on this condition as you were before, and constantly having to worry about it, how it was going to challenge you. So you would possibly say that if someone is suffering with headaches, they should at least consider this as an option?
Absolutely, I would. I mean, to think of having 3 days in your life without a headache before was just something I kind of laughed at, and now I could go 3 weeks, 3 months, I don't even know. I mean, and not have one.
Right.
It's just not an issue.
Good, good. Well, that's great. I want to thank you for sharing that with our audience, and we look forward to continuing the journey.
Yes, absolutely.
Thanks again.